Welcome back to another episode of Drug Talk, everybody. In today's video, I want to quickly go over 3 things that you should be aware of before using MacroBid or Nitrofurantoin. Number 1, it is very important to finish the entire prescription or the complete prescription of MacroBid that was given to you by your prescriber. Many patients are under the impression that if they start to feel better and their symptoms go away, they can stop using this medication, but this is not the proper way to use MacroBid. Often, a patient would only have to use this medication for about a week or maybe 3 days after their urine is sterile, so it shouldn't be that much work to finish the prescription. Other patients may use MacroBid prophylactically or preventatively, so they would take it once daily on an ongoing basis. The problem with stopping MacroBid early is that it promotes antibiotic resistance. If you do stop using it early, there's a chance that your urinary tract infection could return and it could come back with a more difficult to treat bacteria. Having said all this though, if you feel like you need to stop using MacroBid early due to side effects, this is totally reasonable. Just make sure that you keep your prescriber in the loop and informed so that you can make a proper plan for further treatment. Number 2, MacroBid may change the color of your urine. Many patients who use MacroBid find that their urine changes to a dark yellow or dark brown color. This is one of the main counseling points that patients are told when they pick up a prescription of MacroBid, and they're often instructed that they shouldn't be concerned by this changing color because it's often harmless, and the color of their urine will return back to normal sometime after stopping MacroBid. However, it should be noted that dark urine can also be a sign of more serious side effects, such as liver problems or anemia. So you shouldn't be concerned if you just have dark urine on MacroBid, but if you have dark urine accompanied by some of these other side effects that I'm about to go over, then you might want to get checked out by a physician. So some of these side effects may be nausea or vomiting that doesn't seem to go away, stomach or abdominal pain, a yellow tinge to the eyes or skin, severe tiredness, or a rapid heart rate. And number 3, this medication can sometimes rarely cause serious lung problems, which could potentially be fatal for some patients. These serious lung problems can occur within the first month of therapy with MacroBid. However, in some patients who are using it on a more prolonged basis, so using it prophylactically or preventatively like we mentioned earlier, they may not experience these side effects until about 6 months after starting MacroBid. So there are a few symptoms to note here that if you experience these while using MacroBid or after using MacroBid, you should get checked out. If you experience a cough that doesn't go away, chest pain or shortness of breath, as well as trouble breathing, joint or muscle pain, as well as blue or purplish skin tones. That's all we're going to talk about today with MacroBid, but before you take off, I wanted to let you know that you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.